Great. I've got a few people saying, are you going to record this? Because they won't be able to make it right now. So they're going to watch it after the fact. So hopefully no one minds.
That's okay. It's part of, it's there in posterity. Eh?
That's for sure. Anyway, my name's Scott Wheatley. I'm the Executive Director of the Cloverdale Chamber of Commerce, and I just want to welcome everyone today. But before we get started, I'm going to go off script already and just let you know, Minister Dix, that you are my wife's favorite minister. So.
Yeah. I knew you had fantastic taste, Scott. I already knew that.
I don't know if I should be jealous or not. That's it.
Well, you know, you always got to frame these discussions, you know, because there's the old saying, which we don't say too much anymore, about the one-eyed man being king or queen, or one-eyed woman being queen. You know, it depends how she considers all the other ministers before you really sense that. But that's great. Thank you.
But before we begin, I would like to acknowledge that we are meeting today on the traditional territories of the Tsleil-Waututh, Squamish, Musqueam, Fitzwilliam, Katzie, Kwantlen, Quilquam, Matsqui, Quequot, Semiahmoo, Tsawwassen, and Stolo nations, and I really hope I pronounced all those correctly. We thank them for allowing us to meet and learn together on their territory. And the Cloverdale Chamber represents businesses in East Surrey, including Clayton Heights, Cloverdale, and Campbell Heights. Our mandate is to support our members through advocating for businesses and organizations within the district, providing business and community connections. I would like to welcome our moderator for today, our president of the Chamber, Rebecca Smith. She's also executive director of the Surrey Hospice Society. So over to you, Rebecca.
Thank you, Scott. And thank you everyone for joining us today for this very special presentation. As noted earlier, if you were joining us prior to our going live, we have postponed this by a week, and we were really looking forward to Minister Dix joining us. So we're happy that he could make it today. Before I begin, I'd like to thank our sponsors and give them an opportunity to say a few words. Sources Community Resources Center, David Young, Chief Executive Officer, is here today. David?
Thank you, Rebecca, and pleased to be one of the sponsors for this important presentation from Minister Dix. And certainly the pandemic has underscored the need for us to continue to expand our medical capacity in the province, and really looking forward to this development in Cloverdale. As many of you know, our agency is concerned about many things, but social wellness for community is our mission, and we are looking to develop and grow and expand our free, no barrier counseling services to young people in Cloverdale, and invite people to contact me, and I'll put something in the message box about that if they have an interest in making a referral or supporting us with that project. A shout out to our colleagues at Cloverdale Community Kitchen around Coldest Night of the Year. You'll notice that that is coming up again in February. They host an event in Cloverdale. We host one in South Surrey and White Rock, and hope everybody can support those endeavors to raise money for people who are homeless, hurting, and hungry in our community. Thank you.
Thanks, David. I am looking to thank Starline Windows for their support as well, but I have not seen Leslie Nolan, their Chief Operating Officer, yet, so I'm going to skip ahead. And thank Surrey Association for Community Living for their support. Corrine Wimbill, their Executive Director, is here today. So Corrine?
David was said a lot of things that I wanted to say, so I won't repeat, but I do want to say I'm very thankful that the hospital will be in Cloverdale. As somebody who lives and works in Cloverdale, I'm very happy to have it there. And also I just wanted to say it's been a really stressful couple of years, and in my leadership at Surrey Association for Community Living, supporting people with developmental disabilities and their families through this pandemic. But I just wanted to say to Minister Dix and to Dr. Bonnie, thank you so much for your guidance through all of this, because I know every day was hard for me, but I kept thinking it's going to be even harder for them. So that really helps me through it. So thank you for everything you do, and especially thank you for the hospital that you're bringing to Cloverdale. Thank you.
Awesome. Thank you, Corrine. I will circle back and just say thank you to Starline Windows. They are also sponsoring today, although their Chief Operating Officer Leslie Nolan will not be speaking. I will now bring up, last but not least, our sponsor for Updown Business Solutions in Kyocera for their support. Adam Smith, Printer Solutions Specialist, is here today. So Adam?
Hey, excellent job on saying Kyocera right. That is one of the key things. A lot of people don't familiar with that, but I wanted to say thank you. It's an honor to be here. It's an honor to be part of the process as Vice President of the Cloverdale and District Chamber of Commerce. We think business and community is so important in the area, and we've just proud to be part of this. And if we can help local communities and businesses with their office equipment and solutions, it's been difficult for everybody during this pandemic and ongoing pandemic, and hopefully we're getting to the end of it. But we've been delivering solutions, whether it be photocopiers or printers, in safe manner to help people with their businesses and keep them running during the time. And thank you, Minister Dix. It's awesome to have you here and awesome to be part of this. And we look forward to hearing all about what's going on with the new hospital. Thank you.
Thank you, Adam. Now I'll just take a moment to introduce you again to our guest speaker today, the Honorable Adrian Dix, MLA, Minister of Health and Minister responsible for Francophone Affairs. I'm going to take a moment and give you a little bit of Mr. Dix's background. He was first elected as MLA for Vancouver Kingsway in 2005 and re-elected in 2009, 2013, 2017, and of course, 2020. He's the Minister of Health and Minister responsible for Francophone Affairs. Since being elected MLA for Vancouver Kingsway in 2005, Adrian has represented his constituents and their concerns advocating for children in care, seniors, treatment for workers, and public health research. Adrian served as leader of the official opposition from 2011 to 2014. During this time, he proposed a BC-wide colorectal cancer screening program, insulin pump coverage for young adults, and lower generic drug prices, all of which became provincial policy. Mr. Dix will share his remarks, which will be followed by a question and answer forum. The questions Mr. Dix will answer today were submitted to me and the Chamber of Commerce in advance of today's event. If we have some time extra, we will address questions that may come up in the chat or through question directed to us, but we will start with Mr. Dix and his opportunity to speak first. Thank you.
Hey, thank you so much, Rebecca. Thank you to the Cloverdale Chamber of Commerce and for your patience, because I know that we're going to come last week. And as you know, we've had, shall we say, a challenging time. It's been a challenging time for a couple of years with the COVID-19 pandemic. We had some issues that we were resolving last week. So it's great to be here today and to talk to all of you. We've been talking about doing this together for about a year. And I'm hoping to come to Cloverdale sometime in the next year where we can have some time to be in person and talk about really the exciting developments in healthcare in Cloverdale, which are considerable. A new hospital, the work we're doing with the Progressive Intercultural Services Society for New Long-Term Care Center, which are so valuable, the new primary care centers, including nurse practitioner ones, led ones that we have in Cloverdale, is a lot to discuss. And this will have very significant implications for the broader community and the business community. Cloverdale is going to become a center of healthcare in BC, and the co-location of the new hospital, the new Surrey Hospital, we'll call it the Cloverdale Hospital, you can, if you like, on the same site as Kwantlen Polytechnic University. And I think this is a key question in the future, which is that issue of health human resources, not only having a hospital, but having the staff there. And that co-location on site with a major post-secondary institution is really important. I know I see the list of people from KPU here. I recognize from Vancouver Day, Steve Cardwell in that group. It was just a fantastic leader. It's great to have him on the call. I want to also acknowledge my colleagues on the call and other elected people who are on with us. In particular, of course, Mike Starchuk, who's the MLA for Surrey Cloverdale, who just is to describe him as a relentless advocate for healthcare in Cloverdale is to greatly understate it. And for the whole community, it's great to have him on the line. Mike is a remarkable guy. I believe that Stephanie Kajua, the MLA for Surrey South, is on the line. Stephanie and I have worked together on she's been on one side, I've been on the other side of the house, and then we switched and all that stuff, but we work together very well. I hold Stephanie in very high regard as an MLA, and it's great to be great to have her on as well. I think his worship, which I like to say, Daryl Walker is on the line, and I've known Daryl for a while. So before he was his worship and now after, and I don't think he's changed at all. So it's great to have Daryl on the line, as it is Councillor Linda Annis, Councillor Brenda Locke of the City of Surrey. And the City of Surrey, it should be said, has been a relentless and positive supporter of this project at every level, in the most important ways, in ensuring that we go through municipal procedures in the most direct possible of ways. And I make this point, that Surrey is a very good place to build a hospital, because the City of Surrey, the costs here, municipal costs are lower because the city has been at every level, from Mayor McCallum to Councillor Locke to everyone involved, to all the staff, supporters of the hospital, assisting us at every step of the way. And we'll need, of course, much more of that in the next coming years, but we're genuinely partners in this. And I want to acknowledge Councillors Annis and Locke. And I no doubt miss a bunch of people, so I'm not going to start listing them all off now, and just get to a couple of the issues I'd like to talk about. First, I'd like to talk about the COVID-19 pandemic, because, you know, for me anyway, it's obviously, and for people in BC and for businesses in Cloverdale and everywhere in BC, this has been something that's been profoundly disruptive. We had our first briefing, Dr. Henry and I, and our most recent one about 15 feet from here, and at 10 o'clock today. We had our first one on January 28, 2020. In the interim period, through multiple waves and challenges, BC's done two things. One, we have the lowest level of mortality of any equivalent jurisdiction in North America by a significant margin. And that's not a government success, that's a collective success of people, of businesses, of communities, of healthcare workers. And it's a significant achievement for us in BC. We've also had, of all the jurisdictions in Canada, the most consistent approach to orders. And I know that this is a source of difficulty and frustration for businesses, because this is unusual and different than we've ever experienced before. But we've tended to focus and understand, and our provincial health officer, Dr. Henry, and her team understand that every time you do an order, it has other impacts than just dealing with the virus. And so we've been consistent and serious in that process. And compared to really any other of the jurisdictions that have faced significant COVID-19, we've had consistency there. And we've had remarkable support across the board from chambers, from the business community, who have supported our efforts at every turn and ensured that their customers are safe, that their staff are safe to the maximum possible extent. And of course, that continues to be important now with the Omicron variant of concern with us. I want to talk about where we are right now, and then we'll get on to the hospital, which is a broader issue concern to the audience. But I would say this, that we've gone in BC from the beginning of December to the end of December, basically from 3% test positivity in our PCR testing, which is a good sense, standard sense of where we are. It's a good sample of where Omicron is in BC, to 25% in a month. And that has been true across health authorities. So Fraser Health had been doing relatively well during the wave of the Delta variant, which had mostly hit the north of BC. And we saw significant changes. And so action has been taken as a result, the action that you know. First of all, we've had the most remarkable vaccination program, I think, in the world in BC. And the critical role right now, an additional role right now, has been the role of community pharmacy. I saw that the people at PharmaSave were on the line here from Cloverdale, but really at community pharmacy, whether it's PharmaSave or Shoppers or London Drugs or other community pharmacies or Save On and so on, I'll stop listing them now, but community pharmacy across BC has played a central role, such that last week, 130,000 booster doses were provided at community pharmacy, and about 350,000 plus across the province. We now have, of those over 70 who are in the highest risk group, we have about 85% of those eligible vaccinated. Amongst clinically vulnerable people in the groups 1 and 2, we have about 85% vaccinated. Of the whole population, we've reached 1.75 million booster doses on about 4.1 million second doses. So that's the eligible group, which is significant progress. And by the end of January, we're going to have more than half of people vaccinated. I want to emphasize a couple of things about this. I think that if you look at what we presented today, and I encourage people to go online, you can see it on my social media feed if you want to find it there, or on the BC CDC website, when it talks about the risk of hospitalization for people, and at every level, and in every category, whatever your circumstance, whether you're like me in your 50s with type 1 diabetes, which means I have one major additional risk factor, or whatever category you're in, being vaccinated reduces dramatically your risk of hospitalization. The reduction for me, it means that I would be 9 times more likely to be in hospital with COVID-19 unvaccinated than I am now, and twice as likely if I had not had my booster dose. So we're asking everybody, everyone in the audience and in your advocacy, in your communities, in your business groups, in your networks, to advocate that when people are invited to be vaccinated, that they get vaccinated. Because the risk in certain categories, particularly those over 70, with the Omicron variant of concern, is a significant risk. And that's the group of people. And even though the vast majority of that group of people have been vaccinated, a very significant number have not, in the tens of thousands. In fact, as of Tuesday, about 50,000 people over 70 had received invitations and not booked appointments for a booster dose. Vast majority have. We need those people to come and get their booster doses. And there's all this discussion online about vaccination. Fact is, 93% of people in BC, adults in BC, have their first dose vaccination. So I think the issue in many respects is settled. The people I'm talking about there who've been invited to get their booster doses, they've all had 2 doses. They're demonstrated supporters of vaccination. They just got to finish up with their booster dose. In addition, I would say, those 5 to 11, we need to encourage parents of children 5 to 11 to register their children to get vaccinated as well. This helps make families safer and children safer. And at the present in BC, about 48, 49% of children have been vaccinated. It's been open for some time, and about 58% have registered to be vaccinated. We need those numbers to be higher. In Fraser Health, it's about the provincial average. I think it's about 47% of children vaccinated. So we need those things to be higher. In addition, we've taken other steps, and you know this, and this has been challenging in places. New measures in different areas on December 20th, 23rd, 29th, 31st, and last week, the requirement that all businesses have in place COVID safety plans, which is a requirement of law and is important. And I think most businesses, we've got used to that idea now, but really digging in right now on the need to ensure that your workers are safe, and workers are safe in BC, that business owners are safe, of course, and that customers are safe. And so we really need to do those things, and those orders have been put in place. In addition, because of the very high prevalence of the COVID-19 variant of concern, the Omicron variant of concern, we're making changes in healthcare services. So if you think about what we need to do, and we need to adapt in the next couple of weeks, that's meant back before Christmas, we announced that we were going to be delaying and postponing some non-urgent scheduled surgeries. And non-urgent scheduled surgeries sounds like it's not serious. Every one of those surgeries is important, medically necessary, and critical for the health and well-being of people. And we intend to rebook every single one as soon as possible. But it shows the seriousness of where we sit right now, that we were prepared to do that, and that we did it far in advance of when the need actually was coming, when Omicron was going to hit a significant number of healthcare workers. Right now, healthcare absenteeism, by that I mean people off sick essentially, is about 50% higher than it was 1 year ago at this time, and about 40% higher than 2 years ago, which was a higher season of the flu. And of course, every one of those workers does necessary and important work. So that increase in people off sick has a real impact on us. So we're making these changes and we're taking these actions together to deal with this. I think that for all of us, we want this to be over. And I imagine the frustration that many people feel will kind of just be over. But the virus doesn't argue with us, doesn't debate us, doesn't talk about orders, doesn't ask whether we go to spinning classes or whether we work on pottery or whether our kids go to hockey or go to dance. It just lives to transmit, and we have to respond to that by doing the most we can both to protect our healthcare system and protect as much as possible, especially those most vulnerable to serious outcomes from getting sick. And that's what we're trying to do right now. But I want to appreciate the incredible work done in Surrey, because Surrey has above average vaccination rates. Cloverdale has above average vaccination rates. And this is because, in many respects, of the leadership of the people on this call and others who have been leaders in seeing that happen, and an understanding of the impact that COVID-19 can have on communities. So I want to just start with that, because people ask about COVID-19, and because I think people want to know about that. Hasn't stopped us. So the one thing this pandemic hasn't stopped is the new Surrey Hospital and Cancer Center. And that's good news for everyone. As the budget last year made clear, the second hospital is coming to Surrey, and there's a budget, and that budget would make it, in terms of contribution from the provincial government, the largest hospital project in the history of BC in dollar terms, $1.6 billion. And it's expected to be complete and open for patients in 2027. And the reasons for it are obvious, I think, and ones that I was arguing for 15 years ago when I was the health critic for the leader of the official opposition, and I argue for now, is that Surrey is simply the fastest growing community in BC, one of the fastest growing communities, if not the fastest growing community in Canada. And this means increasing demand for health services. And as you know, right now, Surrey is maybe the youngest community in BC, or amongst the youngest communities in BC. But that transition is going to happen too. It's going to be much more reflective of the broader population and the utilization of healthcare services in the broader population as we move towards 2030 and 35 and 40. In other words, the Surrey population is going to get older, just as the rest of the population is getting older, and much more meet that population. Is why we need to enhance healthcare services in Surrey. It's often said Surrey is going to overtake, of course, Vancouver's population by 2041, and all these other questions. But really, it's two things. It's the overall population and the need for the broad range of healthcare services. And then it's what's going to be a very significant and growing seniors population, who are the largest consumers of healthcare services. We actually utilize government services, is why we have universal systems, right? That in different ways at different times of our lives. When we're children, principally, when we're young children, we use health service a fair amount, and then not so much, and then a lot, right? And all of our experiences are the same. That at different points in our lives, we're going to not need healthcare services, perhaps for years on end. This is not true for everyone. Those who live with chronic diseases, it's not. But there's going to be periods in your life where you consume almost no healthcare services, or very few in the course of a year, and then years where you consume a lot of them. And that's why we need universal programs to deliver. So here it's a commitment to build a second hospital in Surrey and a state-of-the-art regional cancer center, in addition to the cancer services provided at Surrey Memorial Hospital. This will be the fourth cancer center in Fraser Health. On November 21st at 4th, 2021, we announced a request for qualifications, inviting teams to express their interest and qualifications for designing the new hospital. That process will lead to the identification of up to three proponents who will be invited to participate in the RFP process. Then the contract will be awarded. Construction will begin in 2023, in the middle of 2023. And again, the hospital is expected to be open for patients in the summer of 2027. It'll have 168 inpatient beds, 5 operating rooms, 4 procedure rooms, an emergency department with 55 treatment spaces, virtual care options for all clinical service areas, a medical imaging department, 2 MRI machines, 3 CT scanners, and the new cancer center as well will include an oncology ambulatory care unit, 50 exam rooms. We'll also have 54 chemotherapy treatment spaces and room for 6 linear accelerators for radiation therapy to provide care for people diagnosed with cancer. And if you think of that and you think of the context of that, understand that because of an aging population, we expect in British Columbia to have about 50% more people living with cancer in 10 years, 50% more in 10 years. And that is difficult news because it's challenging to provide care, but also good news. It means that our outcomes are better for people getting cancer treatment. And with an older population, we have more age-related cancer. And so part of the way we've wanted to respond to this was adding cancer centers in regions, not building bigger cancer centers where we have now, but expanding out care around regions. And that means the new center, the new Surrey Hospital, but also centers in places such as Nanaimo and Kamloops. It's a major development, of course, for the area as well, for the whole area as well. And I think for the community, for the business community, for life in Surrey, it's going to mean a lot more, in Cloverdale, a lot more people coming for work. It's going to become a major employer. As you know, Fraser Health is by far the largest employer in the region now. It's going to mean the additional staff coming with the hospital, but also it's going to continue to make Surrey a more attractive community to live in. It's a valuable addition to Surrey life, in addition to all the other things that we're adding to healthcare. Finally, I just want to talk a little bit about those things, because I think they reflect both the challenges of the healthcare system, but what we need to provide. You know about Access, which is the new nurse practitioner primary care center, opened in Cloverdale in September 2020. That White Rock, South Surrey has a new primary care network started in April 2020. That we've added 2 urgent and primary care centers in Surrey. One opened in November 2018, the other in May 2020. Those are major primary care announcements, including the addition of MRI capacity in Surrey. We've obtained for the public system a private MRI, as you know, and we've reduced wait times for MRIs significantly. In British Columbia, we were significantly below the national average in terms of providing diagnostic care, which meant that for a lot of people, they had to go outside of the public system to get fundamental care. And this allowed people effectively to get ahead on wait lists in the public system by paying a little bit of money for a private MRI. And we're changing that. We've gone from 174,000 MRIs in BC when I became Minister of Health on an annual basis to 260,000. And we did it by using our public system better, essentially, by moving to more 24/7 utilization of the MRI machines we have. And it's an extraordinary success for healthcare workers that isn't talked about enough, is the effective and increasing access to diagnostic care that's been put in place in our province. So I think I'll end it there because we want to have a bit of an exchange, and I go on about Surrey healthcare for a long time. But I wanted to express my appreciation to everybody in the audience, to the nonprofits, to the local businesses, to the community, to the hospital foundation that's on the call, the post-secondary institutions. This is an exciting time for healthcare in Cloverdale, and we've got a lot of work to do, but we're on track, we're on schedule, we're on budget for the largest provincial contribution to healthcare we've ever seen in one project. And I think that speaks for the advocacy of the community, of MLAs such as Mike Starchuk and Stephanie Kaju, of the whole Surrey community, the whole Cloverdale community. It's the right place, it's the right time. We're coming to Cloverdale with a second hospital, and it's going to make life better for people in the community and for businesses in the community as well. Thanks for having me today. Happy to take your questions.
Awesome. Thank you, Minister Dix. That was a lot of information and I did try to take notes, but I'm sure that others are as well, but we do have some pre-existing questions.
Sure.
And I am going to try and work my way through those. So I'll start with, I'll just go through the list as it is, and then I'll throw in a few of mine as I'll take some executive privilege. Can you talk about your plans for staffing the new facility? We already know that every hospital is understaffed and every department that was pre-pandemic. We know that there is an age bubble where there are a lot of retirements coming. We are already challenged with having sufficient numbers of GPs in the province. Who is going to staff this new hospital?
Well, it's going to be doctors and nurses and health sciences professionals and healthcare workers and all of the others, all the support staff in housekeeping and dietary staff. That's who's going to staff it. We have in BC and put in place and have increased the capacity of the system to respond. I'll just give you an example in terms of long-term care, because it's not just hospitals, it's long-term care homes. When I became Minister of Health, 85% of care homes were not staffed at the provincial government's own standard, right? That we had 75 care homes in BC that were dramatically below standard. So the standard, so people understand, is 3.36 hours per patient per resident day. And we had 75 care homes that were under 2.9, which is essentially 2 hours and 45 minutes per patient per week below standard. And we've raised that standard so that there's no care homes in that circumstance now, zero, none. And that the provincial average is 3.4, which is above the provincial standard. And it's the true of every health authority, including all the care homes in Surrey. So how do you do that? You do that by training more workers. And we've done that especially since the pandemic happened with what's called our HCAP program, which supports public beds in private long-term care homes and in public long-term care homes. So that's really important. And we've met that test. But we're going to have to do that across the system. And really, the Surrey Hospital, the second Surrey Hospital, is going to be a place where people want to come. But we need, in Canada and in British Columbia, because not all the issues are British Columbia, a health human resources plan to meet all of our tests in healthcare for home support workers and for long-term care workers and for health sciences professionals and for family practice doctors and to fill institutions like the second Surrey hospitals. I'm confident we're going to do that. We're going to put that in place. But it is the single biggest challenge, I'd argue, setting aside COVID-19 and the existing challenges, the single biggest challenge facing the system. Because, you know, sometimes people say the single biggest challenge is money, but money is something that we debate in the political process. We decide we want to fund something, and I think there's more support now to fund healthcare than there's ever been before. But we need, this is still a labor-intensive, people-centered profession and occupation and area of care. And so we're going to need to increase the number of nurses. That's why we invested $95 million in nurse training this year. Increase the number of family practice doctors, health sciences professionals, and of course, healthcare workers across the board. And that's what we're working to do. And so we're going to meet the test in the case of the Surrey Hospital, and having new healthcare facilities that are top of the line help us to recruit people as well. But that challenge of cancer I talked about, of 50% more people getting care, that means we're going to have at every level, for example, of cancer care, more people. And that's beyond what the hospital question is. My view in general is that building new healthcare facilities, and we're doing about 16 of them, which are mostly replacements. Surrey is unusual in that it's a greenfield, it's a new facility, because Surrey is special, and it's special because it has so many more people there coming and has been underserved in the past, I'd argue. By that, I'm not making a political judgment. I'm saying that's been true for decades. But at a time when Canada started restraining costs on health services, that was the time when the growth of Fraser Health took off. So Fraser Health has had historically the lowest levels of acute care beds per capita. And that's why we're building a new hospital in Surrey. We need people for it. We're going to train them, work them. We got to treat them well. And it's, you know, it's a real challenge right now, as you can expect, because I think everybody in the system and every level is exhausted. But I also think this is the most important work you can do, and we're going to find the people to do it.
Quick, hope this is a quick one. When is the construction actually expected to start?
Summer 2023. So we go through, we're at the RFQ level now. So we're going to qualify 3 bidders, and we're going to have an RFP. Someone's going to win the RFP, and then we're going to get going.
So
started in summer 2023, open the summer of 2027.
great. That was a quick answer.
For the first time. First time. That's my New Year's resolution, is to answer questions more quickly. But I'm not doing well so far. I think it was 6 minutes on the first answer. So
Well, you got 50-50 so far. So let's see how we go. I'm going to read this one verbatim because I'm not 100% clear on it. Will there be a separate, quote, walking wounded, quote, unquote, area for urgent care or urgent care section away from the ER, allowing the ER to be used for what it is for, emergencies? Hopefully this will prevent the ER from being filled with cuts, bruises, minor fractures, etc.
Excellent point. And as you know, we're building urgent and primary care centers across BC, including the two I mentioned in Surrey. There's one in Newton right now, one near the Surrey Memorial Hospital. And intention of that is to have places that offer primary care, basic healthcare to people that are open, for example, on nights and weekends. Part of the challenge in ERs are that they're the only places that are open all the time. And if we could all have our separated shoulders and knee injuries and cardiac issues and everything else during work hours, it might be more convenient, but that's not how it works. And we all know that, right? We all know that. So what we're going to continue to do, what we're doing in South Surrey, is building out a primary care network of services. Because there's two ways that we need to respond to that. One, especially for people with chronic disease, we need preventative care. So part of it is responding better in the primary care system so that people don't end up in the hospital. Because once you end up in the hospital with a serious illness, it's a tough business, right? So we want preventative care, and then we want alternatives for people, and that's one of the purposes of both primary care networks and urgent and primary care centers, to build up that network of people in the community so that we're not filling our hospitals with people with lower levels of illness. If you look at Surrey Memorial Hospital, I think the last time I checked, about 17% of people presenting at the ER could be served, for example, in an urgent primary care center or somewhere else. Now, Surrey Memorial is a major high-tier important hospital in terms of emergency care right now in the system, and the second hospital is going to help it a great deal. And so they have a higher level of acuity than other hospitals. So does Royal Columbian, which serves people in in Surrey as well, especially in the north side. Sometimes we take them there. And so absolutely, you need to have a primary care system in place, because if we don't have that primary care system in place, we simply won't be able to build hospitals big enough to take in everybody. And it's not the appropriate place. You don't you don't need to have every soccer game at BC Place, right? If a big crowd, you have a nice field and you have a nice soccer game. You need to have the appropriate venue for care, and then you need to be able to use people to the full extent of their skills. So we've increased, for example, the number of nurse practitioners, like at the Access Clinic, by 67%, the training positions in the last couple of years, because that in the community helps you deal with it. So the short answer is yes, urgent and primary care centers. There's more than a couple of dozen in BC right now, 2 in Surrey, more coming.
What we've learned from this pandemic is that healthcare isn't just about our bodies. It's also very much so about our mental health. What we've seen in the past is that there are often backlogs in ERs, as well as the hospital in general, dealing with mental health issues. Will there be mental health care provided at this new hospital? And is a provision therefore?
Yes. And I think that what you're seeing, and to take a step back from it, I think people will be interested to know what we're facing right now, which is now 2 years into the pandemic, really. I mean, it was declared in March 2020, but it's been with us since January of 2020. This, for me, it has been, is an increase in this latter period of those presenting in hospital with mental health and addictions challenges, right? And that number has gone up through the latter half of 2021. And just to be clear, to be admitted for a mental health issue at an acute care hospital means you have serious issues, right? Generally, we don't treat them that way, and that's not the best way. to treat it. These are chronic illnesses like my diabetes. Most mental health and addiction care requires a long-standing care. So we are facing very profound challenges. I think if you look at the public health system going back decades, the level of care for people needing mental health services is dramatically below that we get for physical health care services. And you can't deal with one by replicating the other. A broken leg heals in a certain sort of way. It may leave you with lasting trouble and the need for rehab, but eventually, for most people, they get back doing what they're doing before they break their leg. Whereas a mental health condition is much more like my diabetes, right? And so we have to empower people more to address their things, provide them the means to deal and to manage, as we would do any chronic disease, their circumstances. And the Surrey Hospital will be part of that, the second Surrey Hospital, but really what we need is stronger care in the community. And finally, everybody knows this, since 2016, we've had another public health emergency, which is the overdose crisis that has affected Cloverdale, affected Surrey and every neighborhood in BC, every single one. And the number of people passing away has reached, I think, unprecedented proportions. It was coming down going into the pandemic, and now it's gone up. And all of those things that we have needed to do, including more social isolation, have increased the crisis, the toll of the overdose public health emergency. And it's not just those terrible numbers that are provided in the coroner's report every month that we're addressing. But in addition to that, people who are injured in that emergency, right, that require long-term care after an incident. So they are saved from the worst outcome, which is death, but are dealing with long-standing impacts of both their addiction, but also the direct impact of incidents that occur. And so these are real challenges for our system. And I think increasingly the need for more healthcare services, mental health services is going to be there. And then the ongoing need to add the services we need, for example, complex care services in community, so that people get the supports that they need. But really the answer to mental health service issue isn't space and acute care, although we'll need that. It's spaces and it's supports in the community to allow people to live with challenges that are going to be with them throughout their lives.
Speaking of which, I'm aware that Cloverdale has been shortlisted for an establishment of a foundry, but is waiting for word on future expansion on that program in the province. Are you able to provide any information on the government's intent to plan and proceed with additional foundries?
There's going to be more foundries. And my colleague, Sheila Malcolmson, is the Minister for Mental Health and Addictions. I don't have anything to announce on that today, but clearly that model is one of the many models we have to follow. We're pursuing, as Minister Malcolmson has talked about this week, some important complex care models that are part of our community system, not really the healthcare system or the housing system, but we need to deal with these circumstances so that people, yes, live in communities, but they have the supports they need for that to be successful. Because otherwise we have what we see, which is too often movement from either from healthcare to perhaps to the public safety system or the prison system in some cases, to the streets, to other. So we need to break some of those cycles, and that's going to take a lot of work together. But I think some progress is being made. But look, it's a massive challenge. And on the foundry question, I'll leave it to Mr. Malcolmson to make those announcements. But obviously, we're very committed to that system, which I would say was started in the time of the previous government and has been expanded under our government. And that demonstrates, I think the support across both political lines, but also in communities for that model.
Okay. Bring it back a little bit closer to home again on the Cloverdale specifics. Is there anywhere online that we can go to see the design of the new hospital or participate in feedback on it, particularly also with regard to upgrade in surrounding roads or infrastructure? Obviously, a development of this size is going to have impact on our transportation avenues and road systems, as well as transit in the area. So it would be very helpful for those of us who live here and want the best for our community as well as the hospital to be able to give our input.
Well, some consultations happen already. I think Fraser Health has that, and what I'll do is I'll share that information if we want to advise into that process. We're at the RFQ stage, which means we'll have qualifying bidders, and then we'll move to the design stage where people can see what it looks like. But we can go see the site and understand. I think the site is well selected. There's always a lot of debate. There were other sites, and the land was sold, and so on and so forth. So we selected this site, which is currently the site of Kwantlen Polytechnic University. We looked at this site because it was already in public hands, and that has some value. And we're going through consultation process around it, of course, to make sure everything's right, but it's going to be there. And the advantage of this site, I guess, and there's going to be all of those questions, for which there'll be consultation both at the Fraser Health level and at the municipal level in Surrey with respect to roads to make sure that works. But as a site, it couldn't be better selected. And I just want to emphasize the co-location with Kwantlen means there are public services on the site or in the area now. And that connection between Kwantlen and the new hospital, I think, is going to be profound, both for Kwantlen as an institution, but also for the hospital itself. And so as Kwantlen continues to develop as a polytechnic university, and it's truly an outstanding place for young and old to learn at, that this is going to really add to that. It's going to be an extraordinary synergy between Fraser Health and the post-secondary system. And as the first question showed, that's really important.
And I'd like to just bring it back again to the fact that Surrey, as you mentioned, is on track. And in fact, actually, it's 10 years short of being bigger than Vancouver. Will be the biggest city in British Columbia. And as such, it's really important that we get this second hospital. But knowing that population is growing and that we're headed that direction, and Vancouver already has 5 hospitals, is there foresight to look for additional properties to build out another hospital for the future? We're not getting any smaller. The demand for services are only getting bigger. Pandemic has taught us that we're greatly in need of more. And what we saw before, and you mentioned it yourself, there was land previously bought for a future hospital in Surrey that was disposed of when we needed it the most. So is there future planning in place to make sure that there will be land when we need it for the next biggest investment in British Columbian health history?
Well, one hospital at a time, I'd say. I would say this about the Vancouver hospital question. This is an important question, right? What have we done at Peace Arch? We've just finished a major project at Peace Arch Hospital, expanding the expansion at Langley Memorial Hospital, expansions at Surrey Memorial Hospital taking place in the last period, the new Surrey Hospital. So you're seeing a very significant increase in acute care. And, every community is faced with its history and historical decisions, right? And if you look at BC Children's Hospital, right? And, once you've built a hospital, it serves the whole province. It's not really Vancouver's hospital, it's Surrey's hospital, it's Dawson Creek's hospital. BC Children's is a great place, but it's everybody's hospital. It's located in Vancouver. Now, if we were building a new children's hospital today, would it be built in Shaughnessy? In Vancouver, I don't think it would be. It would be built in Surrey because, Surrey is the young community and Vancouver tends to be an older community, partly because it's harder for young families to live there, right? This is a practical reality. It's that part of Vancouver. So we have on the west side of Vancouver, if people know Vancouver, west of Maine, basically we have right on the edge of that is Mount St. Joseph's, but basically we have St. Paul's, BC Children's, BC Women's, Vancouver General Hospital, and University Hospital on the west side of Vancouver, which is going to containing fewer and fewer people in the context of BC. So if we were going to build BC Children's again, we'd build it in Surrey. Of course we would. We'd be looking for it, but we're not. We can't, and we've just made a major investment as a province in it. It was made by the previous government to increase service of BC Children's, and we've added to that. You can't move BC Children's now. We've spent billions there. And so that's where that hospital is going to be, even though you're right, that if we were starting afresh and we were building a new BC Children's and we didn't have it in a location, we'd be building it probably in Surrey, right? More central to the Metro Vancouver area. So this is some major growth in health services in Surrey, and we got to build through this. And one of the reasons it's been, but you know what I think people have to remember is it's not just hospitals, it's long-term care. If Surrey is going to be like more communities in terms of seniors population, we're going to need proportionate share of long-term care homes. That's why we have our joint venture with PICS, who are Think on the Line. There, it's going to be more home support and home care. It's going to need more primary care and other services, because it's not just building hospitals, although that's important, and that's what we're talking about today. It's all the other areas of healthcare.
I think that has exhausted our questions that were submitted prior to your joining us today. I'm just checking the chat to see if there's anything in particular that would be answerable. I would give you probably a 60%, 50 to 60% on shortening your answers, but I'm glad you didn't shorten them. We want fulsome information, and that's important to us.
50 or 60%, it sounds like I'm back in school.
Well, we're all learning. We're all learning through this pandemic.
That's what I used to get back in school. I think maybe
is there an RFP process for pharmacy going into the new hospital?
No, and so the pharmacy is part of the RFP process, but pharmacy is central to the provision of care at a hospital. I think people understand that more now. But there isn't a separate pharmacy or a pharmacy arrangement. There will be providers around the hospital. You'll see, sometimes you see, I won't name a coffee company, but you'll see people bidding for those contracts and so on. If it's providing services for the outside, we're bringing some of those contracts back in, of course, and as well. But the pharmacy will be a key part of the hospital. There will be a pharmacy, and it's just, and there'll be Fraser Health pharmacists dealing with the needs of people at that pharmacy. But you know, if I can say, I think one of the things that we've done in the last year is dramatically expand the role of community pharmacy in the healthcare system. We'll be doing more of that. We've got to allow people to work to the extent of their skills. So for the first time last year, community pharmacies delivered the majority of flu shots in BC. This year, I think it's 1.2 million flu shots in community pharmacies. And now they're doing, I think we'll be doing over the next number of weeks, 150,000 COVID-19 immunizations a week in community pharmacies. It's a real achievement for the sector in the integration of the sector. And we simply couldn't be engaging in the immunization campaign we're doing right now without community pharmacies. So it's central to that. But the pharmacies we have in hospitals, those are Fraser Health pharmacies or Vancouver Coastal Health, depending on the hospital, and that will continue to be the case.
Interesting. Thank you so much for all your information. I think we are at our time for the day. So I wanted to thank you again on behalf of the Chamber. That concludes our time. And I would love to invite you to come and join us in person when it's possible and enjoy a wonderful lunch, because we always have fabulous food at our meetings. And as you said, we have been planning this for about a year, and we really, really appreciate you coming on. And Zoom being the way of the day, we appreciate your taking the time. So we also want to thank our sponsors for today: Sources Community Resource Centers, Starline Windows, Surrey Association for Community Living, Uptown Business Solutions, and Kyocera. And to all of you for attending today. It's so important that you participate in the democracy of our province, in the development of our community, and in our daily lives. So this makes a difference to all of us, and I thank you so much. And if you're looking for it, we have been recording today's meeting, and it will be available through the Chamber office. Thank you, Mr. Dix.
Hey, thank you. Take care, eh?
Yeah. Bye-bye.